Today we have had a very successful meeting of the National Cabinet.
Friday was a sad day for the health of millions of Australians. Prime Minister Anthony Albanese announced that mandatory COVID isolation periods would be scrapped Australia-wide. So how did Albo arrive at this decision? Well, it sounds like the day before he had a chat with Professor Paul Kelly.
The Grim Reaper.
It's the Grim Reaper, dude!
And asked for some advice on scrapping mandatory isolation, and it would seem he got the advice he asked for. Albo has really crossed over into some ScoMo areas on this one. When in opposition, Albanese would tell us that we deserved a government that would listen to the experts and their health advice, and that we deserved a government that would value and believe our scientists. Now, as PM, when it came to making a decision with the potential to impact the health of millions of Australians, he's relied on the advice of one man, choosing to bypass AHPPC, or the Key Decision-Making Committee for Health Emergencies, entirely. It was an announcement that seemed divorced from common sense, logic, science and public health. So let's walk through some of the press conference.
We have agreed today that we will end, states and territories will end their respective mandatory isolation requirements on the 14th of October. The pandemic leave disaster payments will end at that time as well, with the exception of people in high-risk settings, so aged care, health care, disability care.
Pandemic leave is gone, which will potentially lead to more virus circulating in the community.
Can I thank Professor Kelly for his report to today's meeting and for correspondence that will circulate to you, the advice that we received.
So yesterday the Prime Minister did ask me for some specific medical advice in relation to this proposal to remove the isolation period as it currently stands.
Key point here, the Prime Minister asked for specific medical advice in relation to removing mandatory isolation periods. The PM received the advice he asked for.
We are in a very low community transmission phase of the pandemic here in Australia.
Nope.
We're really not. First, the case numbers being reported are likely to be significantly lower than the reality. This is due to factors such as the reduced availability of PCR tests, the reliance on the less accurate rats, as well as self-reporting. Even taking all that into account, we still saw a significantly higher number of cases this September compared to the same time last year. We may have very low transmission in terms of the unmitigated shit show that has been 2022, sure, but significantly higher than anything we saw in 2020 and 2021.
It's time to move away from COVID exceptionalism, in my view, and we should be thinking about what we do to protect people from any respiratory disease.
The key words there are, in my view.
It does not mean that we have somehow magically changed the infectiousness of this virus.
Good point. We haven't changed the infectiousness of the virus. What we have done, though, is strip away any and all public health measures in favour of letting it spread unchecked.
As I've stated in the letter, I believe that removing the isolation period at this time is a reasonable course of action from the public health point of view.
I'm not sure you can say that from the public health point of view, given that there was apparently no consultation with other public health officials.
Did this go to the Health Advisory Committee, and was there a consensus if it did?
We haven't specifically discussed this matter. I was asked for this advice yesterday and I provided it as the Chief Medical Officer to the Prime Minister.
One train of thought, though, that I've seen doing the rounds on social media is that this decision was all the doing of the New South Wales Premier, as if he was some sort of Machiavellian puppet master pulling Albo's strings, forcing the PM and the other premiers to fall in line behind him. I'm sorry, but anyone that believes that is incredibly naive.
It was a unanimous decision by the National Cabinet today and had the support of all premiers and chief ministers.
Unanimous. Everyone agreed. The difference between the Dom and the others was that the Dom was the only one willing to lay his cards out on the table in advance. I'm sure the others were quite happy for him to run out in front and take some of the initial heat and soften up their own constituents. Make no mistake though, this was a decision all of National Cabinet agreed with.
Could you talk us through what impact you think this change would have on cases, hospitalisations, deaths?
So what I can say about the effect of this, that remains to be seen, and we'll continue to be looking closely at that.
Now that's perhaps one of the more concerning responses. To me, it sounds as though the potential health impacts of the decision either haven't been worked through and considered, or the impacts are known but will be kept behind closed doors. Given that Albanese has chosen to go down the Scott Morrison path and maintain the veil of secrecy over National Cabinet, we may never know the answer to that. One thing we can say, thanks to Dr Monique Ryan, is that when Professor Kelly says we're not seeing a major picture of long COVID in Australia, that could likely be because we haven't really started looking yet. No one is collecting the data.
I believe that we should always act in a proportionate way and that now is the right time for this to occur, this change, and that got the unanimous agreement of states and territories today.
This is Albanese's decision. He could have ensured that there was wider consultation, but he didn't. The longer-term impacts of this decision on the health of Australians may not be known for years, but the impacts and outcomes of the decision will be Albanese's to own. Okay, let's pause for a second. I know I'll lose a few subscribers with this video, but before you click that unsubscribe button, consider this. Scott Morrison is Prime Minister. He reaches out to his Chief Medical Officer on a Thursday afternoon. He asks for some formal advice on a proposal that will have widespread health impacts for the country. The advice is provided later that same day. The key decision-making committee for health emergencies in the country is not consulted at all. The next day, Scott Morrison announces that the decision has been made. Now, would you wave that one through, or would you be taking to Twitter with pitchforks? Given that the decision does not appear to be all that evidence-based, it's not a surprise that it conflicts with the views of countless medical professionals nationwide. I mean, I'm struggling to find an expert in the field that thinks scrapping isolation is a good idea. Professor Brendan Crabb hit ABC News not long after the press conference to provide an expert view on the policy shift.
What's your reaction to the news that mandatory COVID isolation is being scrapped?
Well, it's a disappointing, pretty dark day, actually. It's not just illogical and ill-informed, but for me, I find it quite distressing. The chief health officer, or chief medical officer, you heard there saying we're much more immune now, and so we can look forward to sort of less COVID as a result. Well, it's true we're much more immune, but we just had our worst wave in July and August. We had far more deaths than we had earlier in the year. We had more hospitalisations than we had earlier in the year. And this notion that somehow COVID is like the flu is just wildly wrong. It's 40 or 50 times worse than the flu for severe outcomes. And it's also a different infection. It's an infection of the organs in your body, of your heart and of your brain and of your blood vessels. And it's leaving this long COVID burden that is possibly worse than the acute burden. So, quite a disturbing day. Directly, isolation is very important, adjunct to vaccination and to, treating the air, cleaning the air and wearing a mask. It's all we've really got. It's also of little cost if there's low COVID. So one of the reasons given for scrapping it is there's less COVID around at the moment. So why not keep it? Because there's less cost with it, and of course it helps knock the top off the next wave. So it's a bizarre decision.
Yeah, it's hard to argue with that.
You need to understand that we've got 20 to 25,000 Australians who will die this year because of COVID, a good 15% increase on our normal death rate. These are people who would otherwise have lived. I didn't hear that really stressed today, and that's one of the really distressing things. This is a forgotten group of people. It's a terrible epidemic that's going on at the moment. It's nothing like any other respiratory disease, and I find that just quite a disingenuous line of discussion.
He's right. The Friday press conference made no real mention of the widespread carnage that we've seen in 2022. The sad reality is that there have been almost more COVID deaths in Australia since Albo became PM than under the entirety of ScoMo's watch. That's an unenviable comparison. The professor then appeared on Sunrise the next day to drop more truth bombs.
Australians think it's over. That's why we don't wear masks. That's why our vaccination rates are flat. That's why our businesses haven't got their indoor spaces ventilated very well. That's why testing rates have dropped off. We're on track for 25,000 Australians to die this year, more than would usually have died. I mean, it's an extraordinary death toll. They need to know that, and the good news is we can do things about it. It does not mean lockdown. It doesn't mean anything draconian. That's good for our health, good to protect our most vulnerable people, and good for businesses. So let's be straight, and then we can get out of this. By fudging things as we are, pretending it's over, we actually make matters worse.
Besides all the obvious health impacts, I wonder what impact the removal of mandatory isolation will have on workplaces, and in particular OH&S. Will this shift the onus onto business? Will they be forced to introduce their own mandatory isolation requirements in order to ensure a safe workplace? Whatever happens there, I certainly can't see how unchecked virus circulation is going to be good for business. Australia, under both the Coalition and the Labor Party, has spent the majority of 2022 sleepwalking through the pandemic. Neither side can hold their head high. Now that even the most basic mitigations have been wound back, we're stumbling towards the festive season and what will likely be another wave to coincide with the UK and US winters. Hopefully this past week has taught a few people that a bad call is a bad call. One side shouldn't get a free pass just because they're not quite as shit as the other one. Winding back all public health measures is a bad call. It sends the wrong message to the community, and it's a decision that the community will likely end up paying for in the years to come.
The public need clear information based upon the expert medical advice. But it's also urgent that the Australian Health Protection Principal Committee, made up of Commonwealth and State Chief Medical Officers, provide the latest information and advice to all Australians. This is absolutely critical, and I believe is what Australians are asking for.
Why won't anyone think of the cafe owners?